So, and let me know if the audio is fine now. It's just I connected back again. Hello. Is the audio fine? Can you all hear me clearly? Is the audio fine? It's fine? Okay, so then I'm just going to add a doctor here back again. Okay. Yes. Is it
Am I
clear?
audible now?
Yes, I'm just going to ask them if you're audible to me. Let me just see in the comments. Is the audio fine right now? Whose connection is breaking? Is it mine or is it Dr. Shreya's? Okay, yes, the audio is fine. All right. So we don't have any audio issues at the moment. So let's continue. Um, I will probably have to do the brief all over again, as in I have to introduce you because I think we have a lot of new people who have come here. So let me introduce Dr. Shreya Agarwal to you. She's a resident doctor at Nair Hospital, and she's currently doing a residency in pathology, right?
Yes.
And you have been a COVID warrior since the past 1 year, since we've all been battling this new disease. And I wanted to just understand COVID better. So I want you to tell us, a little bit about COVID.
Okay. So, as I was saying, I'll start again. So, we have been dealing. Am I audible?
Yes, yes, you are now.
Okay. So, we've been dealing with this since the last 1 year, and the
Yeah,
situation is very grim this year because the virus is changing its form and it is very unpredictable this year, the way it is affecting people.
there
So,
is again
last
a
year, about the age of 40.
problem, I think. Eh, I'm so sorry, but right now they think
My voice.
the sound is breaking, everything is lagging. I have because I can see you and hear you perfectly.
Even I can hear you perfectly.
Okay. Uh, can it's clear that your net is broken. Okay, so I don't know because audible with video is not good. Okay. Now what do I do with this? Place and audio I'll get. Okay. So let's continue. So yeah, I wanted to know about COVID, like the symptoms of COVID, how it spreads. Now they say that it is airborne. So what do we need to be a little careful about, and a lot more things about COVID that you can just give a brief about.
So the basic symptoms that you have to be very careful about is a sore throat, fever,
Right.
cold, headache, or any diarrhea or any gastrointestinal problem. Okay,
Hmm.
all right. Having said that, in today's time, any symptom should be considered COVID unless proven to be
Wow.
because we
Okay.
are dealing with a pandemic right now, and since its
Yeah.
behavior is so unpredictable, you cannot really
Oh.
rely on a specific set of symptoms. So if you
Hmm.
have any symptoms, you should definitely consult a doctor and go and get tested.
Okay, yeah, because recently I got back from Hyderabad and I was a little concerned about my sore throat. It was not a sore throat, but I felt a little bit of tightness in my chest. And I isolated myself for 3 days. And before I could get on my medications for my throat, I just wanted to do a test just to rule out that possibility, which I did and it tested negative. But
Great.
yeah, sometimes there's a confusion where your RT-PCR test comes out negative, but you feel that you have all the symptoms.
Yeah, so that is happening for many patients right now, actually, because again, the answer to that is that the virus is mutating, it is changing its form.
Right.
So, the RT-PCR kits that we had previously
Hmm.
were used for certain strains of virus. Now, since the virus is
Okay.
ever changing, those kits really sometimes cannot detect the variant forms of virus. Another reason
Okay.
is due to decreased virus load. Sometimes the load of the virus in your body is so less that the RT-PCR test cannot
Doesn't
detect.
detect. Okay. And right now, even I mean, you do there is an antigen test which tells you whether you have had or contracted this earlier, correct?
Yeah.
So antigen is something that the labs are not currently doing. Private labs are not doing, and it's only done at government
So
facilities.
we have three tests that are actually being performed at my hospital. My hospital is a government setup. So you have a
Okay.
rapid antigen test that will give you result
Right.
within half an hour. So you can be sure,
Huh.
like, if you want to isolate, you can just get that test done. And if it is
Hmm.
positive, you have to get isolated. That means you're positive. But the efficacy
Okay.
of that test is not really that good. So you have to go with an
Okay.
PCR test to get confirmed. Another
Okay.
test is the CB-NAT test, which is actually very good. Let me tell you, the CB-NAT test here is as effective as the RT-PCR test. Also, it
Hmm.
gives very rapid results. So you'll get results within 4 hours, and it is very effective.
Okay.
So this is a new
Okay.
test that is has start the testing has started in India now.
Mm-hmm. Because when I was in Hyderabad, the first test that we did on arriving the set was it was an instant test where they take the swab and they put it like on that indicator, how you have the pregnancy
Yeah.
test strip.
Yes.
Yeah. So I was amused by it because first I thought, like, why are they testing pregnancy over here on set? It's for everybody. And then I thought, oh, they're like, oh, it's instant COVID test. So yeah, even something like that also has come. I wanted to ask you about the vitamins that we're asked to take, like C, vitamin D, zinc. Does this actually help really in building our immune system?
See, anything does not help quickly. Like building your
Hmm.
immunity, of course, takes time. But these things are actually supportive. Especially
Hmm.
vitamin C is very good. If you have to take one single thing, I would recommend vitamin C to be taken.
Okay,
And
and what will be the dosage?
500 mg tablets are there, chewable tablets. They have this orange flavor, so you don't even have
Right,
to worry about taking them. You can take
right.
them daily for 15 days, 20 days, for a month. It's fine. It is fine. You can continue with
Okay.
vitamin C for a
So,
long.
but this happens over a period of time. So it's not like instant and yeah,
No.
so you have to, okay. Also, there are a lot of different vaccines that keep coming. And here also we have quite a few vaccines that, are listed. So what are the difference in these? What is the difference? Is there a very noticeable, I mean, a difference that we could, some say they have like the dead virus, some say they have the live virus, and how do we know what's good for us?
So I won't go into the science of it, but basically,
Okay,
like right now in India, the situation is that you have to take the vaccine which is available to you right now. Because
right.
we don't really have, we cannot afford to choose given the situation and the time we are in right now. You cannot really
Hmm.
choose. And also, both of the vaccines have near about same efficacy. Covishield and
Okay.
Covax, which are widely available
Hmm.
right now, have the same efficacy. The risk of reinfection with Covishield is slightly higher, that is 0.03%, and with
Hmm.
Covaxin, 0.02%. So again, we are talking
So
in
this, hmm.
something. So
0 point something.
yeah, so it is very less. So you can go with
Okay.
whichever vaccine is available and just take it as soon as possible is all I would say.
Another question, what I want to ask you about the vaccine is that is it going to be just two dosages of vaccine as of now, or is it going to be like every year we'll have to take two of them?
Actually, studies are right now going on about this. So maybe later, after starting the antibody titers in patients, they might suggest a booster dose after a year. But right now,
So
it is not.
this is not it. It is not just the two doses. We
Right
have to take something more.
now, actually, that I don't know. The policies keep changing. This is all on
Mhm.
a experiment basis going on right now. And
Right.
it is a thing that we've faced for the
Very
first.
new too. Yeah.
Yeah,
So to actually get the actual vaccine will take a couple of years. So this is temporary, and we might have to take this probably again.
we might have to. Yes.
Yeah. Um, okay, and there is something now that a lot of people are talking about, and a lot of people want me to ask you this, which is the black fungus or the mucormycosis. If that, yeah.
Very good of you to ask this question because this is something that really needs awareness right now at this point of time. So, what is
Mhm.
mucormycosis? Is a fungal infection. So
Okay.
it affects people. It is an opportunistic fungus. That means it waits for an opportunity. So people who
Okay.
have diabetes are at high risk of getting this fungus. So with
Okay.
COVID, this fungus has gained so much of importance is because
Mhm.
corticosteroids have been given to the patients, which kind of
Mhm.
suppress the immunity of the patient, causing this fungal disease. Also,
Mhm.
another thing is oxygen is being used, and sometimes distilled water is not
Mhm.
used in the oxygen piping, which can also lead to the
Mhm.
growth of fungus. So, it is mostly seen in hospitalized patients, it is not seen in patients who are being taken care at home.
At home.
Yeah.
Okay. And how does one, I mean, how does it come? How does this happen?
So for people actually at home, I would like to add something that I have been noticing is that people are wearing masks certainly, but people are
Right.
not washing those masks.
Washing them.
Yeah,
Yeah.
people have been using dirty masks over weeks. Like their masks have got blackened, they're dirty, and
Huh.
this is causing the fungus to grow. If not mucormycosis,
Okay.
it can lead to growth of candida, which is another fungus. So just
Right.
be careful that you wash your masks every alternate day, if not daily, and you use a
Mhm.
dry and clean mask. Please do not use a wet and dirty mask.
Right. And I think it is better to just carry spare masks because we tend to sweat a lot. So
Yes,
that helps breeding a lot of these bacteria and all. Okay, so we'll quickly get into the questions that people have asked me to ask you. So first, to start with, the side effects of the vaccine, and does the side effects show in all individuals a similar way? Like a lot of them get fever, body ache. My mom had fever, body ache, but my dad had nothing. So why
okay.
does that vary?
So it depends upon the immune response of an individual. So what
Hmm.
is vaccine basically is you need to understand the vaccine is a nano dose of the virus actually. मतलब
Okay.
जितना वायरस विल बी रिक्वायर्ड टू प्रोड्यूस द डिसीज उसको आप बहुत कम कर दीजिए तो बहुत छोटे
Hmm.
अमाउंट में दिया जाता है सो दैट योर बॉडी produces an immune response but you do not get the disease actually. So
Hmm.
if you get the symptoms, there's nothing to worry about that. It is just your body showing an immune response to the disease. So next
Hmm.
time, if the virus infects you, your body is ready because it knows how to respond to it.
Hmm.
That is the logic behind.
Okay. So, there's another question which also says that even after two shots of this dose, you have to still take care the similar way that we're doing now, like all the precautions have to be the same,
Definitely, because the vaccine can only prevent the disease to a certain extent. Take,
but you can still get it
yeah, you can
after even the two
get
shots.
after taking the vaccine because you remember childhood में हम सब ने chicken pox का vaccine लिया. Even after that, many of us have had chicken pox. So
I
you,
also had chickenpox.
yeah, right. So you can,
So,
no 100% effective. You can get the disease even after vaccination.
so is it going to be as bad after taking the vaccine, or is the effect going to be less?
So after taking the vaccine, your body is prepared. Now it knows कि
Yeah.
कैसे मुझे लड़ना है ये virus से. So your body is
Uh-huh.
prepared. So next time when the virus actually infects you, you are not going to land up in a severe disease. Most
Okay.
certainly, I can say is that you are not going to die after you take two doses of vaccine because the
Okay.
body response to the virus is going to be very good. It knows how to fight the virus. So it's
तो
going
वो
to
जो अभी रेस्पिरेटरी का जो प्रॉब्लम हो रहा है वो आगे जाके नहीं होगा अगर वैक्सीन लिया तो
इतना सीवियर नहीं होगा. You won't have a severe
ओके
disease.
ओके um Okay, the second one is what test does one have to do to know if they have ever previously, if they were ever previously infected by the virus? Which I think you've already mentioned the three tests. Can you
Yeah,
name the three tests again?
it's a rat test, then
Okay,
RT-PCR test, and CB-NAT test.
okay. The third one is can someone who is vaccinated get COVID? I think you've already
Yeah,
answered this one.
can get COVID. Yeah.
Is it safe to take the vaccine after 15 days of being positive?
So what the guideline says that you can take the vaccine 28 days after your last symptom, like the day that you have been asymptomatic. 28 days after that, you can take the vaccine.
Okay, so not just after you've recovered and then you can't go and take
And
the shot.
the day that you've tested negative, or if you haven't have had a repeat test, from the day that you were asymptomatic, from that day you
Mhm.
can 28 days, and after that day you can take the vaccine.
Okay. So who all are not eligible for taking the vaccine?
So actually, everyone right now is eligible. In fact, they have
Hmm.
been getting studies that even pregnant and lactating mothers can now take the vaccine, though the data upon that is very less. But
Hmm.
diabetics can take the vaccine, hypertensives can take the vaccine, cancer patients, HIV patients, everyone can take the vaccine. Cardiac
So
patients can.
people who are suffering, yeah, cardiac also, then people who have like had a transplant, liver transplant, kidney transplant, any kind of transplants, who are suffering from heart diseases, any kind of critical illnesses in the past, all of them are eligible to take the
They
vaccine, or
take the vaccine.
should they be asking their doctors before getting the
In fact,
vaccine?
I would be saying that they should be first in the line to take the vaccine because they already have a
Hmm.
comorbid condition. So they don't want to get
Right.
infected. So they should be the first one to get the vaccine, in fact.
Do they need to ask their doctors before they get vaccinated
There
because
are
of their medical history?
there are clear recommendations from WHO that people with these diseases can take the vaccine. But people on
Hmm.
like blood thinners or anticoagulant therapies, they have to consult the doctors once. They can also take the vaccine, but it has to be under medical supervision. So, if they
Right,
have some symptom, their doctor should be aware of it.
right. Um, because I've had, I mean, my dad is a serious heart patient, and my mom has had her share of medical history. So, we definitely wanted to check with their doctors before they got their vaccine, as we heard a lot of news about people getting, blood clots and stuff like that also after getting vaccinated.
Right.
So, yeah. So, is it true that another question also asked me, is it true that either COVID or the vaccine creates blood clots?
Yeah, so actually it is true. It is a known side effect that COVID and vaccine both can lead to blood clots, but
Mm-hmm.
the percentage of people who will be having it is very less with the vaccine. So out of a
Hmm.
million people who get vaccinated, only five people get the blood clot, as compared to a
Hmm.
lot of people, like in hundreds or thousands people who get the blood clot when they suffer from COVID. So it is always better to get the vaccine.
Right. So now, if you're at the hospital, you will know how to deal with it. But what about people who are at home and they don't know if they're having blood clots? So is it safe for them to take a blood thinning medication along with their COVID medications that they're taking?
No, you should not start it without consulting a doctor. If you
Hmm.
have COVID presently, there's a test called D-dimer. So you can get
Okay.
that test done and it shows
Hmm.
that level of thickness of your blood. So depending upon
Okay.
the values of the test, your doctors will start you on an anticoagulant.
Okay. So they should be asking their doctors
Yeah, started
after
on.
they are COVID positive. Yeah. So it's very important actually this awareness of the blood thickening is actually you need to be aware of this because this can cause problem. We don't know which percentage we come into, the minority or the majority. So it's better to be safe and just ask your doctor and get the test done. Um, right. Oh yeah. So the next one is the new strain present just in the air and can it spread without touching?
So again, there have been new reports about this that the new strain is
Hmm.
transmitted in the air. But having
Right.
said that, again, I would say that it cannot. If you're sitting inside a room and you are wearing a mask, it's not going to happen. So another thing is that indoors the transmission of the virus is more as compared to
Right.
outdoors. So when you say
Hmm.
that it's transmissible by air. If you're walking on a ground and there's another person walking on the ground away from you, so it's not going to transmit like that. But if you're going to
Okay.
sit in a fully air conditioned room or a lift, if you're using
Hmm.
a lift and you haven't touched the person or you haven't touched anything, it can still transmit. So that is what it
Even
means.
after wearing a mask?
The chances with mask is very less, obviously, but if you're not wearing a mask and you're using and if you're in an air conditioned, then it's going to transmit.
So tell me one thing, is a cloth mask effective in the cases right now? If
Um,
we wear a cloth mask, which is double layer instead of wearing a double mask.
I don't know to bore you with the data, but cloth masks,
No, but I just want to know if it is effective or not.
okay, a cloth mask can prevent 50 to 60% of the infection, but using double
Hmm.
masks will prevent 80 to 90% of the infection.
But this
So,
is double mask of what? Double mask of the cloth mask or double mask of one disposable and then you wear your cloth mask?
disposable and one cloth mask. The best thing to use
Okay.
an N95 mask, that is the best mask, but if it
So
is not,
one of the N95. So if you're using an N95, you just use an N95. You
yeah,
don't use a double mask.
yes. And
Okay.
you're
Because
using,
N95 is like you sweat inside the mask, like so much.
I know, but even we do our duties wearing just one N95. So we actually are
Uh-huh.
with COVID patients.
Yeah.
It is effective.
Okay. So we've covered another question that way. And another one is now, has this COVID virus started mutating to animals as well? Because
So
there were reports about a lion getting COVID.
yes, I read that in the news. And in some countries, not in India, there have been reports of it getting transmitted to pet animals as well. So
Okay.
that if you have pets around in the house, you can just treat them like you treat your family members. So if they have an infection, you can isolate them. Or if you have infection,
Isolate them. My fellow will never isolate himself.
or you can do the other way around, you can get isolated on if you have infection. So that is what you have to
So,
do.
but now, are there medicines for animals as well for COVID?
There haven't been many reports in India of animals getting infected, like especially pet animals getting infected. So
Okay.
I'm really
I
sure.
hope that doesn't. Yeah, I hope that doesn't happen.
Yeah.
Okay, there are some reports that have mentioned that the vaccine that are made in India are not that effective. Please clarify.
No, Covishield and Covaxin are very effective. As I already said, like they are 70 to 80%
I'm
effective.
so sorry to cut you in here. Can we make this English? Sorry, this is like halfway through our chat already, but can we add, I mean, talk in half Hindi and half English so that everyone understands?
Okay, definitely, yes.
Yeah.
So, so both the vaccines are very effective. Covishield is
Hmm.
75 to 90% effective. Covaxin is also very effective. It is 80 to 90% effective. I have myself
Hmm.
taken Covishield, so and we are on the front line, so I can say that those vaccines are effective.
हाँ,
And I've
और
seen
मैंने जहाँ तक सुना है बहुत देशों में पहले कोविशील्ड गया है और सबसे ज्यादा लोग कोविशील्ड ही मांगते हैं. अभी तो
right,
मिल नहीं रहा है इसलिए दूसरे वैक्सीन ले रहे हैं, बट कोविशील्ड हैज बीन द वन व्हिच everyone has preferred taking.
right,
All right. Okay. Then we've also answered another question where they're asking, do we need to take the same precautions even after 2 shots of the vaccine? So you definitely need to, right? The next question you have here is, after being positive and losing taste and smell, how long does it take to regain that senses back?
Okay, so this really varies person to person. Like I've seen many
Hmm.
patients who haven't got back their sense of taste or smell for months to come. And some people get
Okay.
it back in weeks. So this also really depends from person to person, but you don't have to panic. मतलब I've seen people
Okay.
की taste नहीं आ रहा है, smell नहीं आ रहा है, so they start eating lots of things. They eat something spicy and something sweet. So do not panic. It's going to take time. Give your body time to recover, and you're going to have your taste and smell back.
So it can come back like जल्दी भी आ सकता है या टाइम भी लग सकता है इस चीज के
हाँ,
लिए, correct?
yeah.
Yeah. Um, hmm. Next question is it true that COVID or the vaccine can create blood clots, which we've already answered? The next one is, oh yeah, this one is like a a major thing because everyone सब यही बोलते हैं कि गर्म पानी पियो स्टीम लो गर्म पानी पियो स्टीम लो. Does this really prevent from getting COVID?
No,
ये प्रिवेंटिव मेजर है कि ये सिर्फ to soothe your passage, like your throat and all? Is it for that? What is it for?
has been circulating everywhere on WhatsApp. Like my mom calls me
Mm-hmm.
sometimes saying after I come from duty कि steam लेकर सो जाना. But steam doesn't
हाँ.
really help in preventing the disease. Also, it does not
Uh-huh.
curing the disease. Steam is just
Okay.
if you have a stuffy nose or if you're having cold, you
To
can,
unclog.
yeah, basically just that to relieve those symptoms. It is not going to, मतलब बहुत लोगों को मैंने देखा है whenever they go outside, if they go to the market, they just come back and start taking steam.
Steam.
So that is
Yeah.
not going to help you.
तो गर्म पानी पीने से भी प्रिवेंट नहीं होता.
Garam pani has its benefit in the ways that sore throat है, so it's going to help like in the same ways. But
सूदिंग द थ्रोट, बट
yeah,
प्रिवेंशन के लिए तो बिल्कुल नहीं है.
nahi.
गर्म पानी या स्टीम लेना वैसे प्रिवेंशन के लिए कुछ काम नहीं आएगा.
No, it's a myth. It's not going
क्योंकि
to.
मैं इतने लोगों को जानती हूँ जो दिन में मिनिमम 5 बार तो स्टीम लेते ही लेते हैं.
I know people have
मेरी
been.
खुद की फ्रेंड ने मुझे मैसेज करके बोला, हैरी 8 बार स्टीम ले लो. मैंने बोला 8 बार स्टीम. So I was like, no, that's overdoing it a little bit. And steam helps in opening the blockage a little bit. But
Yeah.
even, yeah, I read there were things जो WhatsApp पे लोग बिना कंफर्म बिना वैलिडेट किए लोग बहुत सर्कुलेट करते हैं बिना ये जाने कि वो ट्रू है कि नहीं.
Hmm.
तो जो भी गर्म पानी और स्टीम ले रहे हैं ये सोच के कि इससे हमें कोविड नहीं होगा, वो बिल्कुल गलत है.
And you don't have to overdo it. मतलब दिन में 5 बार steam लेना is going to actually cause problems to
Cause problem, yeah.
you. Yeah.
Okay, and another question for smokers. How bad is COVID for smokers, and does it have any further bad effects in future?
So for smokers, definitely lungs are infected with smoking. So I just
Yeah.
read it in our data somewhere that for smokers,
Mhm.
the risk of getting a severe disease increases. Apart from
Mhm.
that, there haven't been many studies or data about it. Certainly, you should not.
मतलब वो ही ना, तो स्मोकर्स के लंग्स ऑलरेडी डैमेज होते हैं और कोविड से तो और ही डैमेज होते हैं, तो
It.
लॉन्ग टर्म इफेक्ट्स तो होनी ही है. If you
Yes.
continue to smoke, then don't expect anything good from COVID. Um, okay, so we have a last question here. Please explain hypoxia and how dangerous can it be for COVID patients?
Okay, so what is hypoxia? Basically, is your blood oxygen level falling down. जब आपका
Okay.
oxygen level एक certain level से कम होने लगता है, that is called hypoxia. So
Hmm.
जब भी आपको hypoxia होगा, certain level means on your pulse oximeter, if it is falling below 94 or 93, that means that you
Hmm.
are hypoxic. It should always be above 94. तो जब भी आपको
Okay.
hypoxia होगा, generally you should have some kind of symptoms. जैसे chest
Hmm.
में weakness होगा, difficulty in breathing, short of breath,
Hmm.
even if you walk a
Hmm.
little, you will start having heavy breathing. So
Hmm.
you generally have these symptoms with hypoxia. But
Hmm.
in COVID, what is happening is people are having this thing called happy hypoxia. मतलब even
Hmm.
if their oxygen level is falling, उन लोग को समझ नहीं आता है that they are having hypoxia because their body is not showing symptoms.
Okay.
So I've seen people coming to the OPD with oxygen levels of 50 or 60 and they're still walking nicely and coming and they don't realize that they actually
Okay.
are having difficulty.
तो अभी ऑक्सीमीटर अभी बहुत लोगों ने लेके घर पे रखा है चेक करने के लिए कि ऑक्सीजन लेवल क्या होता है. सो व्हाट इज अ नॉर्मल जो ऑक्सीजन लेवल होना चाहिए हमारे ऑक्सीमीटर?
Always above 94. It should be above
अबाउ
94.
94, तो 94 के बिलो जाना नहीं चाहिए.
Above 94, you don't need to worry. If it is falling below 94, you have to consult your doctor. Also, one more thing that
Okay.
you can do is a 6 minute walk test. So you have to walk for
Okay.
6 and then see if your oxygen level is falling. If it falls below 2 points or 3 points, then you need to consult your doctor again.
Okay, I'm going to try that.
Yeah.
Another thing I want to ask you, जो normal body temperature क्या होना चाहिए? क्या होता है?
So normally, अगर for COVID, I will say specifically, if your body
Hmm.
temperature is above 100, then you need to
Hmm.
consult a doctor. If you have a
Hmm.
body temperature continuously above 102 or 103, that means you have a high grade fever. So you should definitely consult your doctor. So there are
Hmm.
these three things that you have to monitor if you are getting home treated for COVID. Your
Hmm.
oxygen saturation, which should not fall below 94. आपका
Hmm.
temperature, which should not go above 100, and your pulse
Hmm.
rate. So your pulse rate should not go above 120.
Okay. All right. I think we are done with this. And also want to know about proning.
Yeah, right.
Does it
So,
is it effective, and how effective is it?
so proning basically, we do it in hospitals for patients with respiratory distress. But suppose
Hmm.
अगर आप घर पे हो और कोई आपके साथ हो जिनको breathing में difficulty हो रहा है, so as a first
Hmm.
aid measure, till you take them to the hospital, you can ask them to prone. Basically, lie on your belly. Okay, for
Right.
half an hour. This can also be done for patients at home. Many patients are now getting oxygen concentrators at home because
Right.
of
Hmm.
bed being available. So you can do this at home also. So you have to lie on your
Hmm.
belly for half an hour. Then you have to lie on both of your sides for half an hour each, and then you have to sit upright for half an hour.
ठीक है. तो मैं हिंदी में ये दोहराऊंगी. पहले आप अपने पेट पर सो जाए. If that's the translation. हाफ एन आवर पेट पे सोना है. फिर अपने साइड्स पे, जो अपने लेफ्ट साइड पे है और राइट साइड पे हाफ हाफ आवर. एंड देन द फोर्थ वन इज
बैठना है for half an hour. You have to उठ
बैठना
के
है अपराइट. बैठना
upright.
है
Yeah.
हाफ एन आवर के लिए. ओके. सो डज दिस like is it better than having a oxygen concentrator at home, or is it
Again, ये treatment नहीं है COVID
equivalent
का.
to it?
No, 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 no. This is not a treatment for COVID. ये treatment नहीं है. ये
No,
बस
no,
एक
no, not treatment. I'm saying for the oxygen supply. Is this
like
somewhere
along with it, not
you do
separately.
along with it?
Yeah.
Somebody who doesn't have oxygen, that level of oxygen in them at that point of time, and cannot find the concentrators or oxygen cylinders
Right.
anywhere. Is this that effective?
It can help as a first aid measure till you actually find the source or you reach the hospital. You can ask the patient,
So,
आपने देखा, आपने प्रोब लगाया, आपने देखा कि ऑक्सीजन लेवल फॉल हो रहा है, तो आप पेशेंट को बोल सकते हैं कि आप अपने पेट पर सो जाओ जब तक आप पेशेंट
hmm,
को हॉस्पिटल लेकर जाते हो, बिकॉज दैट इज
hmm,
गोइंग टू हेल्प इंक्रीज द ऑक्सीजन सैचुरेशन. So it can be a first
okay.
aid measure that you can do.
So this helps for how long? 2 hours, 3 hours, 4 hours?
You cannot really tell that, but what happens with lying on your belly prone, जब आप
Hmm.
सोते हो, जब आप अपने पेट पे सोते हो तो आपके lungs को expand करने के लिए ज्यादा जगह मिलती है. So there is
Oh,
more
okay.
entry of air in your lungs, which actually helps in improving the oxygen saturation. So that
Okay.
is the logic behind that. So you have to, if you sleep
Hmm.
like that, तो oxygen saturation बढ़ेगा.
Okay. I think we've covered more or less everything that we have here, the questions at least. Does anyone want to ask Dr. Shreya anything about COVID? Anything related to COVID? Please go ahead. And can you read the comments?
Yeah, yeah, I can. I'll just take up the question.
I can't see. Okay, yeah. Sometimes person is not experiencing any symptom but still tests COVID positive. How can we know?
So, okay, so if you come in contact,
Asymptomatic.
के कांटेक्ट में आए हो हु इज पॉजिटिव, घर में किसी के साथ आप रहते हो जो पॉजिटिव है, तो आप टेस्ट करवा सकते हो. एंड इट इज
नहीं
ऑलवेज
नहीं नहीं, he's asking that कभी कभार symptoms नहीं होते हैं फिर भी आरटी पीसीआर में पॉजिटिव दिखाते हैं. So how do you know who you are interacting with who is not COVID positive?
यू कैन नॉट रियली टेल दैट. बट अगर इफ यू नो ऑफ समवन जिसके कांटेक्ट में आप आए हो और वो पॉजिटिव है, तो आपको टेस्ट करवा लेनी चाहिए.
Okay. And usually कितना दिन लगता है ट्रांसमिट करने के लिए और symptoms to show? How
They
long does it take?
it has a shelf period of a window period of 2 to 3 days is what is being said.
From the day you've interacted with somebody
Yeah.
who's COVID
Yes.
positive. Okay. So that is why whenever you're traveling or you have to wait for a few days before doing a test,
Yes, right.
not immediately.
Yeah.
Okay. Anyone wants to ask anything more? We have 2 minutes. I can only see hellos and highs. Please ask your questions. We need questions. Hmm. How many times a day can we do proning?
Pruning. Yeah, you can do it 4 to 5 times a day, depending on how you feel.
And how do we increase immunity?
Yeah, so like I said, yeah, for immunity, you have to take a proper diet, have more proteins
Mhm.
in your diet, have a protein-rich diet. You can start taking supplements like vitamin C, zinc supplements. All this
Mhm.
is going to help. Along with our desi things you can do, you can take turmeric milk at night. That also really helps.
Okay. Mm, sometimes I feel breathlessness. It has been many weeks, but not any other symptoms. Is there a chance of COVID infection? It has been there for weeks, the person says.
You have to get tested. You definitely have to get tested. It is important that you rule it out.
Okay. Okay. So, I mean, he or she is saying that it's been there for weeks. So, is there a possibility of having COVID for weeks?
It is actually rare, but sometimes you can just feel distress and there cannot be an infection. I would say that you have to monitor your oxygen with a pulse oximeter daily 2 to 3 times, and you have to get
Mm-hmm.
tested. It's always
Okay.
better to rule out the infection.
Is it common to have any symptoms even after testing negative?
So again, as I said कि कभी कभी हो जाता है कि RT-PCR टेस्ट नेगेटिव है even though you have COVID. तो अगर आपको
Right.
लगता है कि आप किसी के कांटेक्ट में आए हो और आपको सिम्टम्स है, so it is best that you get isolated. You
One
know,
more question. Does everyone who has COVID or is COVID positive, do they have fever at some point in time? At
not
some
necessarily.
stage, do they have? Not necessarily. So there are people who will not even have
Who will not
um
symptoms at all. There can be people who are not
huh.
going to show any symptoms, but they can still
So
be
that's
positive.
that's scary. That's very
Yeah, but
scary.
they might have a mild infection. That's why they might not show they might not show
So people
symptoms.
who don't have fever and all, are these the ones who do not really spread the virus?
No, they can spread the virus. Even if you're
Okay.
asymptomatic, you can still transmit the disease. It's just that your body's immune response is so good that you're not showing any symptoms, but you harbor the disease.
Okay.
And
Does vac does vaccine is effective for mute virus?
for mutation, for virus with mutation, the vaccine is certainly effective for many strains of the mutation right now. So you have to go forward with the vaccine.
Okay, there's someone who I think missed our black fungus topic. So can you just give a little brief about it again?
Okay, so for black fungus, I'll I'll divide people into two groups. अगर आप घर पे हो, ऑक्सीजन पे नहीं हो, so basically the symptoms of black fungus that you have